Narcan is a life-saving medicine that can reverse an opioid overdose by restoring breathing within minutes. Opioids range from prescription medications to illegal drugs, such as heroin and fentanyl. Some prescription opioid medications include Vicodin, Percocet, and fentanyl. There are two types of fentanyl: fentanyl that is prescribed to treat severe pain, and fentanyl that is made illegally. Illegally made fentanyl is very powerful. It only takes a small amount to cause an overdose. Fentanyl has been added unknowingly to heroin, cocaine, methamphetamine, and other illegal drugs, including counterfeit or fake pills. When fentanyl is added to another drug, you cannot see, taste, or smell it. This means anyone can be at risk of an opioid overdose. Be prepared and know the signs of an opioid overdose. Signs may include slow or shallow breathing, limp body, unable to wake, unusual snoring, or blue or discolored lips or fingertips. If you suspect someone is experiencing an opioid overdose and cannot wake the person by yelling their name or rubbing your knuckles on their chest, call 911 and give them Narcan. The 911 dispatcher will help you with the next steps. To administer a dose of Narcan, take the device out of the package. Each device contains 1 dose of medicine. Do not press the plunger until you are ready to give the medication. Make sure that nothing is blocking the inside of the person's nostril and tilt the chin to ensure the airway is clear. Insert the tip of the device into the person's nostril and press the plunger. If there is no improvement in breathing after 2 to 3 minutes, give the person an additional dose of Narcan, switching nostrils with each additional dose. More than 1 dose of Narcan may be needed. Once the person begins breathing, or if you need to leave the person, even briefly, place them on their side to prevent choking. This is known as the recovery position. Keep in mind that a dose of Narcan only lasts a short time, and the opioid may still be in the person's system. It is possible that the person may start to experience overdose symptoms again after appearing to recover. Call 911 and follow the directions of the 911 dispatcher. The 911 dispatcher may tell you to start rescue breathing, how to perform chest compressions, or to give more Narcan. Stay with the person until emergency help arrives. Just because someone wakes up doesn't mean they're okay. They may need additional medical care. After receiving Narcan, the person experiencing an overdose may feel withdrawal symptoms that may be unpleasant but aren't life-threatening. If the person is not experiencing an opioid overdose, or if they're experiencing a different kind of medical event, Narcan will not harm the person. Narcan is safe and has no significant side effects. It can even be administered to pregnant women, children, and pets. Don't forget, Narcan is a medicine. Check the expiration date and keep it at room temperature. Narcan can't be self-administered. It's important for everyone to carry Narcan for our neighbors, friends, and loved ones. Narcan saves lives. Recovery is possible. ECHealthAlliance.org